Welcome everybody to a DocTalks presentation, a conversation about the AstraZeneca vaccine with Dr. Baldev Sangara. I'm Jeff Malmgren with the Primary Care Networks. So today, Dr. Sangara will talk about the vaccine and answer your questions. If you do have questions, please put them in the Q&A, and we'll make sure that we get to them as we go through the presentation. This is a PCN presentation. There will be the presentation will be available after this on the BurnabyCoronavirus.com site if you'd like to share it. And certainly there are other resources available on that site around the vaccine and around COVID, and also around the social supports and the other multiple supports that are available through the Primary Care Network's partners and the many community agencies and Fraser Health and the doctors in Burnaby. Just to introduce Dr. Sangara, I know that many of you who've come to these presentations in the past will know him, or perhaps because he's your doctor. He's a family medicine specialist in Burnaby. He's also the medical director for the Urgent Primary Care Center in Edmonds, and he's also deeply involved in the South Asian COVID Task Force in the Fraser Health region and also nationally. So I'm going to turn it over now to Dr. Sangara. Welcome.
Thank you, Jeff, and welcome to everybody, and thanks for making some time out of your lunch to listen to what we have to discuss today. And it's actually a very timely discussion. So what I'm going to do is I'm going to share my screen and start to show you some slides, and we'll go through what the current state of affairs is, and then go on from there. So go. So what is the current state of affairs of COVID-19 in BC? So we're starting to see an average of 1,000 COVID positive cases per day on average per week in the last week. As of yesterday, we had over 500 people in hospital. 161 of them, unfortunately, were in ICU. And we're starting to see that the hospitals are becoming overwhelmed. And as they're starting to feel like they need more beds and ventilators and staff focused on COVID treatment, we've unfortunately had to postpone 1,750 surgeries in the next 2 weeks just to get a handle on this. And unfortunately, since the start of the pandemic, we've also lost 1,550 people in BC. Our current test positivity rate is around 9.4%. That's as of yesterday. And on the brighter side, we have also administered 1.4 million first doses of a COVID vaccine, which now brings us to about 30% coverage with that first dose. And 60% of people that are clinically extremely vulnerable have been vaccinated with their first dose. So those are really good, positive outcomes to move forward with. Which vaccines do we have available in BC? We have Pfizer and Moderna, which are both a mRNA type of vaccine, and they're both available at our mass vaccination clinics that are being run by the health authorities, and you require 2 doses in order to get full immunity. You get first dose now, and then 4 months later you will get your second dose. The other 2 vaccines that have been approved by Health Canada are the AstraZeneca vaccine, which is what we will be talking about later on, and also the Johnson & Johnson vaccine. The difference between these vaccines and the Pfizer and Moderna vaccines are that they're the same technology that we've used in flu shots in the past. So this is an inactivated adenovirus, which has been engineered with the spike protein from the coronavirus has been put into this adenovirus so that our immune systems can learn from them and then develop antibodies. The AstraZeneca also requires 2 doses. The Johnson & Johnson one requires 1 dose. AstraZeneca vaccine And this is breaking news. Just about 15 minutes ago, the National Advisory Council on Immunization for Canada has completed their very, very thorough research and review of all of the data around the world. And they have concurred with Health Canada that it is a safe vaccine. And NACI has approved the use of AstraZeneca vaccine in people 30 years and older, so 1991 and 1991 and earlier are now eligible to actually get this vaccine. The Johnson & Johnson vaccine has been approved for use in Canada by Health Canada and by NACI, but it's not available yet. We are expecting some deliveries possibly by the end of the month and possibly early into next year. Now, just to review, what is the risk of catching COVID, and also what is the chance of infection and death from COVID infection itself? So the chance of infection from COVID in BC as of yesterday was 1 in 4,700, roughly. And the chance of death occurring from COVID infection increases as you age. And so in the 55 plus age group, we're seeing about a 3.2% risk of death. And as each 5 years goes up, it seems to almost double that risk. And so by the time you hit 85 plus, you're almost at about 68.3% risk of dying from it. And if you look at all of the people that have unfortunately succumbed to COVID-19 in Canada, the majority of deaths, 80%, have been in adults over the age of 65. And unfortunately, we weren't able to save them at the start of the pandemic. We have now made a huge difference after focusing on our patients in long-term care homes and congregate living. We have made a huge difference in the number of infections that are occurring in seniors, where we're now not seeing any further deaths in the seniors since that vaccination campaign was completed. The AstraZeneca vaccine that's available to us in Canada, the brand name is called Covishield. And Health Canada approved its use in anyone over the age of 18. NACI, as I mentioned earlier, just announced that they have also approved its use in anyone over the age of 30. So that slide is unfortunately, I forgot to update it. So it's supposed to be 30 plus. But currently, as of this morning, BC is still only vaccinating people born in 1981 or earlier. I'm expecting this to be updated by the Ministry of Health and Dr. Henry possibly later this afternoon or possibly by Monday. In the UK, Singapore, Australia, the vaccine, the AstraZeneca vaccine is already being given to people 30 plus and very successfully improving their control of the pandemic in their countries. In the UK, we have seen about 2 months ago, UK was going through their second wave, and they started the mass vaccination campaign with majority of doses being AstraZeneca. In the UK, 22 million doses of AstraZeneca were administered. And over that next following 2 month period, their infection rates plummeted, dropping about 60 to 70%, which is really encouraging for the rest of us here, where we're starting to see our numbers going up. I think we're about a month away before we start to see our numbers really dropping in a big way. We've also seen a similar response to vaccines in Prince Rupert. Prince Rupert was one of our hotspots here in BC. And prior to Prince Rupert has 12,000 people living in it, and they were getting about 100 new cases per week about a month ago. The government focused on that city administered vaccine to the whole community. All the adults received vaccine, and within 2 weeks after receiving the vaccine, the number of new cases has plummeted from 100 new cases per week to 3 cases per week, which again, that gives us confidence that we're on the right track. AstraZeneca we have in Canada administered 1 million doses of AstraZeneca, and we have some results to share with you about that. The big thing that we've all been hearing in the media is, the fear that was created around this rare risk of blood clots in the brain. The fancy name for that blood clot in the brain, there actually has 2 names, because of course in medicine we never give anything one name. We always try to complicate things for the public. So one name that you may be hearing is called vaccine-induced prothrombin immune-mediated thrombocytopenia, or VIPIT for short. The other name that you may hear in the media is cerebral venous sinus thrombosis, or CVST. It means the same thing, just depends on which jurisdiction that you're looking at results from. So if you're looking at it from Europe or in North America, we'll be talking about VIPIT. If you're talking about Australia or the UK, you may be reading about CVST, but it's exactly the same thing. These are small blood clots that are occurring in the brain and causing stroke-like symptoms. The chance of VIPIT in real-world data, especially accumulated from Europe and especially UK, they've really focused on trying to identify what this was. The real-world data shows that the incidence of VIPIT is anywhere between 4 to 11 in a million. There's my next slide will explain why there's a difference and a range for that to happen. As of this morning, we actually have 3 cases in Canada to date. Another case was reported this morning in Ontario. And so if we look at that data, Canada's data shows that it's about 1 in 350,000 chance of VIPIT occurring in people vaccinated with AstraZeneca. The data shows that the VIPIT occurrence is more common in younger people, but it has occurred in a range of anywhere from 18 years old up to 93. And the average age seems to be 47. And the risk of occurrence is slightly more likely in women, but not much. It was about a 45-55 ratio that occurred between men and women. And the majority of these cases all occurred after the first dose of AstraZeneca. And one case did occur after the second dose in one person in England, and they didn't have any response after the first one. They seemed to tolerate that first dose. The mechanism for VIPIT is, as the name suggests, it's a immune-mediated response. Very hard and difficult to predict as to why it happens. We're still researching why it happens, but the mechanism that we've been able to identify so far is our immune system recognizes the antibodies that are being produced by our own immune system as being foreign bodies. So therefore, the antibodies are then getting destroyed, platelets are getting destroyed, and as the platelets get destroyed, platelets are the small little particles in our blood that help to cause bleeding to stop. As those platelets get destroyed, the bone marrow recognizes that we need more platelets, so it increases its production. And as the production increases, the ability of the blood to clot increases. So that's why you end up getting more blood clots up in the brain. No real evidence so far as to why this happens in 4 to 11 people in a million. Research will continue, but now that we know that this can occur, we have figured out ways to test for it as people report symptoms, and also we have now got treatments available. The 2 earlier cases that occurred in Canada, we were able to identify them right away because we are watching for this. and they were successfully treated and they've recovered from their symptoms. Typically, the symptoms that you will have from VIPIT include headaches, possibly mild blurry vision, tingling or numbness around the face, maybe some weakness in the arms, very similar to stroke-like symptoms. So if anybody's starting to feel that within day 4 or up to day 20 post AstraZeneca vaccine injection, please report that to your physician and get some attention right away. And then we can help reverse that and get you fixed up. So I'd mentioned that there was a range between different age groups. So as mentioned earlier, the risk of these blood clots occurring is more common in younger people. So the risk of some 25-year-old getting VIPIT is about 11 in a million. Comparatively, in a 55-year-old, the risk is 4 in a million. As folk get older, it seems to drop down to 1 in a million, and that's in the 75 plus age range. Now, obviously, nobody wants to have a blood clot occurring, and this is fear-inducing, but we need to put this into perspective as to what is the risk of actually getting one of these blood clots, and because every time that we do anything, we actually take a calculated risk. Every day that we get out of bed and leave the house, we actually take a calculated risk. Every time that we take a medication, we take a calculated risk. Every time that we eat food, we take a calculated risk that it's going to be okay, it's been cooked appropriately. So in comparison, I'm going to give you a few numbers here, so just so that we can actually make proper decisions as to, is this vaccine safe or is it unsafe and we should not use it? So the risk of dying from coronavirus in a 25-year-old is 23 in a million. And the risk of a 55-year-old dying from coronavirus infection is 800 in a million. And that's much more than the risk of getting the blood clots from the vaccine. The risk of dying due to an accident or an injury, say on your way to work or going to pick up your kids from daycare or anything like that, in a 25-year-old, that's 110 in a million. In a 55-year-old, that's 180 in a million. So again, much, much higher risks, and we don't even think about those type of things. Your risk of dying in a road accident in a 25-year-old is 38 in a million. And 55-year-old is 23 in a million. Comparatively, I mean, we always say it's as rare as being hit by lightning. The risk of getting hit by lightning is 1 in a million. And so this chance of getting the blood clots from the AstraZeneca vaccine is just slightly higher than the risk of being hit by lightning. And that's just a comparator. So we also have to compare what is the other risk. And so the risk of, if you're not vaccinated and you catch COVID, the risk of developing blood clots from the actual infection is 1 in 100 or 10,000 in a million. That gives you a relative number as to how high the risk of getting something really nasty from the infection itself. If you catch COVID-19 and you are hospitalized, your risk of getting one of these blood clots in the hospital increases to 1 in 5 or 200,000 in 1 million as a comparator. Now, people have also been discussing in the media about the risks of various different types of blood clots. And I wanted to bring that up forward because that you may have heard of this, and I want to share that same data with you, but I also want to explain to you that the types of blood clots are different. The blood clots that occur in women that are pregnant or using birth control are more what we call deep venous thrombosis, or DVT, blood clots that occur in the legs or around the abdomen. This type of blood clot is different. It's more from sluggish circulation, and as the blood doesn't move, it just congeals and clots, right? And so that's a risk of that occurring. The blood clot that occurs from the vaccine is a very, very small clot that's specifically up in the brain. So the chance of having women between the age of 15 and 45 actually have a 1 in 3,300 chance of developing blood clots just normally, just because of their hormone mixture, etc. And if they happen to be taking a birth control pill, then that risk goes up to 1 in 1,600. When women become pregnant, their risk of getting blood clots increases to 1 in 300. So relatively compared to the other blood clots, these are much, much more common. And if anybody happens to be a smoker, the risk is even further increased. To put things into perspective as to the risk of what COVID-19 causes to us, Statistics Canada has given us data that shows that the number of deaths from COVID-19 in 2020 exceeded all other leading causes of death except for cancer and heart disease. So we're talking serious consequences if we're not getting vaccinated and protecting ourselves. So in summary, the advice from Health Canada and from our National Advisory Committee on Immunization is that the benefits of the vaccine far outweigh the risks in the majority of people from the actual, the benefits of the vaccine far outweigh the risks of the vaccine in the majority of people. The risk of being infected with COVID-19 and being hospitalized and dying far outweighs your risk of the rare VIPIT syndrome that occurs. So advice, please get your shot. As it says on my shirt here, please accept whichever Canadian approved vaccine is offered to you first. Focus on the rest of your health needs, and let's get life back to normal.
Great. Thanks, Dr. Sangara. That was great. And there aren't too many questions. I have some, and there are a couple in the chat. One of the things that you and I were talking about was, no matter what the facts show as the safety of these vaccines, and whether it's AstraZeneca or Johnson & Johnson, they're impacted by the perception. And that because of that, we may see that some of these vaccines stop being produced at a certain time. It kind of goes to one of the first questions we have is, can we take the first dose of one vaccine and a second dose of another vaccine? What happened if AstraZeneca wasn't around anymore, for instance?
Yeah, no, great question, very pertinent as of today, right? So we are making AstraZeneca vaccine available to a younger group now, hopefully 30 plus. More people will likely get vaccinated by AstraZeneca. And if AstraZeneca is not around, there's currently research being done in the UK and in Germany specifically about that risk. And hopefully in the next couple of months, we'll have the answer to that question. If you've got AstraZeneca first or even Pfizer, can you mix and match these vaccines? So far, early preliminary studies seem to indicate that the answer will be yes, and they will be safe. We've already, the federal government has already committed to, if we need to have a booster dose as new variants come about and variants of concern cause more increased risk in the future into 2022, we don't want to be all locked down forever. So we may need to start vaccinating people on an ongoing basis, similar to what we do with the flu shot. And so we've already got a commitment with Pfizer to get a booster shot made, and we will be then pushing and requesting people to get that booster.
So, the next question is actually is around. Again, I had this question as well around side effects. Is there a differentiation in the normal side effects of a vaccine from one vaccine to the other? And are there any particular ones that come out of the AZ vaccine that you wouldn't see with the other vaccines?
No, so the only different side effect that seemed to be really sticking out was these blood clots that happen. But the more common side effects that we see with all of the vaccines, it's obviously the pain at the injection site. Yeah, most people may report general body ache, general fatigue. When I got my 2 doses, I'm usually quite energetic and upbeat, and I felt tired and worn out for about 36 hours, and it was easy to recover from that. I rested for a day, took some Tylenol, and back on my feet the following day. Some people have also reported that they're getting mild fever, and the mild fever seems to be more common with the AstraZeneca vaccine than, say, the Pfizer or Moderna. But the body aches one seems to be more common with the Pfizer one.
Yeah, I know. I got the AstraZeneca, and I did have like a 1.5 degree fever sort of thing, and but that same sort of thing, that just real tiredness that lasted for about 36, just enough of a taste of it to say I definitely don't want to get COVID.
But no. So remember this: when we get that fatigue and the fever and the aches after vaccination, that's a real strong indication that your immune system has kicked into gear and it's producing the antibodies. And all of your body's energy is now focused on the immune system doing what it's supposed to do. So that's actually a good sign. It shows you that your immune system is actually doing its job. If you don't actually get those symptoms after the vaccine, you fly through it then maybe you're not gearing up enough. That's the feedback from all the scientists.
And it does seem as if lots of folks get a little bit more of a reaction after the second vaccine than they do after the first.
Yeah, so our first dose is the primer dose, right? It just kind of gives you a taste of what's there, and it gets a whole bunch of antibodies being produced. But the booster dose is where you really send everything into overdrive, and your antibody production boosts up, and also you get B cells and T cells being produced that are also going to provide you with a longer term protection. And memory, so that we can continue to fight these various different variants that keep coming up as the virus keeps circulating around the world, and in areas where they're not controlling the virus as well as they could. Those variants are allowed to mix and match and develop and become stronger, and we need to have our immune system boosted in order to be able to fight those.
So, and that goes to a great question. Just this whole obviously variants are on the tip of everybody's lips these days. Is there any research that's been done that you know of that talks about the efficacy of the respective vaccines with some of these variants?
So I'm going to kick myself about not remembering the numbers that the variants are named by. The P1 variant, I do remember that one because it's easy. There's I hate to use where the location that they were found, but when they were identified in the UK, South Africa, and Brazil, those variants, we have been doing some testing against those with the vaccines that we have, and we do see some good results with that, good coverage. With all of the 4 vaccines that have been approved in Canada. Now, this new variant that has emerged out of India, that we are still doing some research on that. The early theories that have been put forward is that possibly this particular variant has more mutations than the other ones, so it may be able to evade our immune system and antibodies that are being produced. And especially in patients that have gotten a natural infection, we've seen that the variants, even the P1 variant and the UK variant, have been able to reinfect people that got infected originally with the first virus that was here. I've got a couple of patients in my practice where they've unfortunately gotten a second round of infections from these newer variants. So this is why it's more important to actually get the vaccine. You get a more robust immune response, and you will be able to fight the variants a little bit better.
And they're starting to report some incidents now of folks who do get for whatever reason do actually still become infected after they're vaccinated. But it seems as if it's pretty clear that the impact is much lower if you've been vaccinated.
That's right, yeah. So the vaccines don't give us 100% protection. What they are offering after 2 doses is around a 95% protection against infection. So that still leaves us with room for a 5% risk of getting infected. And anybody that has had a vaccine, so far around the data that's been presented to us, especially from Europe, from the UK, from the US and Canada, not a single person that's been vaccinated has died. And so that's incredible, a positive sign. Serious illness is reduced by 95%. Risk of hospitalization is reduced by 95%. Transmission risk is reduced by about 90%. Now, they're not 100%. Right, so we still, this is one of the reasons why we, even after our vaccines, we are still supposed to continue with our public health order protocols, guidelines, following them to a T, until we can start to see that there's less and less virus circulating in the community. Then we can start to let our guard down.
And I think that's, that there's a question here around which vaccine is the most effective, but I think that you kind of answered that, but I'd like to hear your thoughts on that. But just reflecting on what you just said, there's some data that even around after the first vaccine, your risk of death is reduced by 100%. Mm-hmm. And so it's quite significant right away. Is it reasonable to compare the efficacy of the vaccines, or does it really come down to what you said earlier? Is the best vaccine is the one you can get today? So
there's a difference in trying to compare lab data when the studies were being done, and this is where the efficacy data kind of is a misleading topic to be going down, right? It all depends on when was the study done, which population group was studied with that vaccine, and which variants were circulating at that time. Pfizer and Moderna did their studies early on when we only had one variant of the virus, so it's easy to target something against that, and hence they were able to show efficacy rates of around 92 to 94%. By the time AstraZeneca and Johnson & Johnson got their studies together, they had a different population group. The Pfizer studies were done in Europe, and the AstraZeneca studies were done mostly in the US, when there were a lot more variants circulating. And some of the studies were also done in South Africa. Again, different variants were circulating there. And so their efficacy rates showed up to be a little bit lower. When we compared it to real world data, though, as I mentioned before, 22 million doses of AstraZeneca were delivered in the UK. Their impact on infection rates were dramatic. All Pfizer, Moderna, and AstraZeneca vaccines in the UK, we can do a direct comparison because all 3 of them were used there. They all reduced the risk of death equally by 100%. They had that impact. They all equally reduced the risk of severe illness and hospitalization equally by 95%. And they all equally reduce the risk of transmission by 90%. Now, if we were to do the same studies, the efficacy studies now using this new variant that's developing in India, and also this new P2 variant that's starting to be heard about from Brazil, we may have totally different efficacy results, but I'm actually more concerned about real world data, because real world data means this is what we're actually going to see when we're starting to use this vaccine in actual public, not in a lab setting.
And I mean, I guess the truth is, the research continues. You've got real world data that continues to be developed. They're also continuing to work in the lab setting against the new variants as they come along, and adjusting formulation as within the parameters that they can in order to be able to make sure the efficacy remains at a fairly high level.
Exactly, yeah. And if they change the formulation enough, they have to actually reissue a new study anyway to ensure that the safety and everything is there. Plus, they also have to submit new data for approval to all of the various licensing bodies around the world.
There's a question here around just whether or not this is one of these, should I take this particular vaccine? If you have an autoimmune disease such as endometriosis, or do you have a higher risk of problems from the AZ vaccine?
So far, the data shows that and it's linked with this particular question, there's an issue that I've heard from other women being told that when they're too close to their periods and their hormones are adjusting, or if they're going through menopause and their hormones are adjusting, that somebody has been telling them that they're at higher risk of developing these blood clots from the AstraZeneca vaccine. And the Society of Obstetricians and Gynecologists has clearly come out and said, no, there's no impact, and it doesn't appear to be any problems there. The only situation in which they have advised us to be careful about is if you have a problem with low platelets to begin with. And they've added a caution in there, just have a discussion with your physician, because each one of us is an individual. That I can give you broad population recommendations, but each one of us is an individual, and we need to get specific individualized advice. So ask your physician. They'd be happy to answer your questions. But
so I think the one that brings up for me is, do most of us know if we have low platelets? Is that something that we would normally be aware of?
If your physician has done any kind of blood work, they would know.
Right. And that is that talk to your family doctor about it.
Yeah.
If you're worried that you're at risk, talk to your family about it.
Yeah. And the other situation that also comes to mind in the same vein is if you've ever been in hospital and had to have a heparin injection, again, have that conversation with your physician. They will know whether or not you've had any procedure requiring a heparin injection to help you get through.
So if there is a blood clot as a side effect, what happens?
So if you start to get those symptoms that I talked about earlier, your risk is for headaches, blurry vision, dizziness, nausea. If you get those symptoms, report them to your family physician. There are specific tests that they can order immediately. And if the tests come back as being positive, then immediately you will be offered a treatment to fix the situation.
Great. There's a question here just around, it's more around the Pfizer. It's a person saying they'd had the Pfizer a couple of weeks ago, told the antibodies will build up over 2 weeks that will protect her. And there was also told that 21 days was needed to be totally protected. And it was saying, and I think that I can reflect on that. And sometimes we hear to 14 days, sometimes we hear 21 days. Is there fact, or is there just good advice here?
It's both. It's both. Neither of those statements was wrong. It's true. Your antibodies are building up, and they build up over 14 days, and they continue to build up over 21 days. They continue to build to 30 days. So the level of antibodies continues to rise between the 14 and 30-day mark. So your protection is increasing over that 3-4 week period. My recommendation is anytime you get a vaccine, a COVID vaccine, and it doesn't matter whether it's a Pfizer one, Moderna, or AstraZeneca, please continue to follow the public health orders. Wear your mask, keep your distance, don't go into large crowds, avoid poorly ventilated spaces. And within a month, you will have your highest level of antibodies circulating, and you will have good protection. And then in 4 months, once you've got your second dose, your antibodies will be even further elevated, with also further boosting of your B and T cells, which will add another layer of protection.
Kind of goes to another question. People are that everybody comes away with, well, they told me 4 months. Will it really be 4 months, or is there a chance that it'll be sooner? And I don't think you know that any better, but
no, but I mean, we can theorize, and we've so when we initially heard about the 3 to 4 week recommendation, that was based on the lab studies that were done, and the lab studies were done in a way that we needed to end this pandemic, and where can we give the second dose so that we actually get a boost of the immune system. So it's a minimum of a 4 week window. So if you give the second dose earlier than 4 weeks, you don't get the boost. And if we look at all of the other vaccines that we use, like a hepatitis vaccine or a shingles vaccine, or even the pneumonia vaccine, so if you want to really boost your antibody production, even for those vaccines, we recommend anywhere from 2 to 6 months. Right, and we see a good response in our immune system. Antibody production goes up. Hence, this was why it was, from a scientific point of view, very sensible to say, let's wait to 3 or 4 months. When the AstraZeneca did their data and studies, their interval is actually 3 months, and that was the recommendation right off the bat. Pfizer had just looked at where do we get that boost up front, and that was it. But so I think we're very comfortable waiting 4 months. There's some research being done in seniors where there may be, as folks that are 75 plus, there may be a slight decrease in the antibody levels at around the 4 month mark. And some research is being done right now to see if we need to maybe give them the booster dose at about 3 months. And again, we'll have that answer soon. We're definitely working hard to find out those answers. And also it depends on the vaccine supply. So if we start to get a huge supply, we can, and we're also setting up our mass vaccination clinics in multiple locations. As our ability to deliver the vaccine increases, we may actually start calling people sooner.
And I think it's, kind of that question kind of goes to, well, if I can get my second vaccine, then I can go out and just live my life. And, as we kind of go back to earlier, that's not really, you still have to follow those precautions, because you're not only protecting yourself, you're protecting others when you're following the precautions that we put in place.
Yeah. So remember, we have to always think that there's a 5% chance, even after the second dose, there's a 5% chance of getting an infection. And so we really want to have as many of our friends and family, co-workers, neighbors, strangers even, we want to encourage all of them to go get vaccinated. So as we increase the number of people getting vaccinated, we definitely see, as we've seen in Prince Rupert, the circulating virus in the community just plummets. And then the risk to everyone goes down. Then, of course, we can start getting life back to normal. And we can actually go shake hands and hug and have a beer and everything else.
There's a question here around the AZ vaccine in particular, and why do you have any understanding of why it hasn't yet been approved in the United States?
There's a lot of theories. Some of it may be political lobbying, and there's other reasons. It's not about the effectiveness of the AstraZeneca vaccine as to why it's not being created or being approved, sorry. AstraZeneca is a vaccine that was developed out of the UK, out of Oxford University. Pfizer and Moderna were developed out of the US. They have US patents. The US government has agreements in place that they will have access to the markets, et cetera, et cetera. So there's other reasons for that approval not being granted.
And this one's there's a couple general questions here around vaccine, and this kind of goes to, you mentioned it earlier, but I think it's worth reaffirming. If we have antibodies in our body, antibody cells, do we still need to get the vaccine? So if I've had COVID, do I still need to get the vaccine?
So when you get a natural infection from COVID, you do produce antibodies, but the memory of that antibody production seems to wane after about 3 or 4 months. And so, and I've seen in my own practice where I've got patients who had an infection in 2020, recovered, felt that they were comfortable, may have not been as good at following the public health orders. And now this year in 2021, they've gotten reinfected. And the vaccines actually provide a 20-fold increase in your antibody production relative to the natural infection. So your ability to continue to protect yourself over the longer term is better after vaccination than a natural infection. And also we've seen that there's less chance of the variants breaking through with that higher level of antibody response.
So this is an interesting question. I know that we're starting to see approval for vaccine for pregnant women. This is a question that I hadn't seen. If you've tested positive for COVID and have received a vaccine, the first dose, is there any evidence or any data that you know about when it's safe to become pregnant? Either after that first dose, or should you wait till after the second dose, so the efficacy, the period after that second dose?
I don't think we've got the answer to that specific question, but the more general response around pregnancy and vaccines has been answered. The timing issue is what I'm having difficulty answering from a data point. I haven't seen any data indicating whether it's better to get pregnant after the first dose or the second dose. The advice has been if you wish to get pregnant, and you can have the vaccine either before getting pregnant or while you're pregnant. And the vaccine is safe in pregnancy. There have been a lot of doctors and nurses that have become pregnant and they chose to get vaccinated by themselves. They made that decision. And after delivering the babies, everything was fine. And in fact, the babies were born producing their own antibodies by themselves. So that's a good sign. It shows that the immune system protection is actually passed on to the child, which is a good thing.
Yeah.
And there were no complications of the vaccine during the pregnancy either. And in fact, Ontario just this morning also announced that pregnant women will be put on a priority list to get vaccinated because the risk of from COVID in pregnancy is much higher. The risk of having miscarriages when you get the COVID infection is quite high, and we want to prevent that infection. And also the risk of blood clots during pregnancy is higher from the COVID infection. And so if you get the vaccine, you won't get the infection, so therefore you won't get the COVID infection-related blood clots.
We really are a living lab, aren't we?
Absolutely. Most doctors are learning new things every night before we go to sleep, and in the morning you wake up and there's a whole bunch more emails in our inbox saying, well, guess what you learned last night is being modified, and here you go, here's the latest information.
So, and just to that, I mean, we talk a lot. I mean, we talk an awful lot, rightly so, about prevention in multiple different ways, the way we act and getting vaccinated. But there's also an awful lot of work that's being done on the treatment of COVID. Can you speak to any of the advances that are being made around that?
Yeah, no, we've figured out that most COVID infection cases have been able to be managed at home with some supportive measures. If there's a moderate level of symptoms, we can manage those at home with simple tablets and oral steroids, possibly some inhaled steroids as well. And if somebody is admitted to hospital, we do have agents now that are available to improve the outcomes quite a bit. We're much further ahead now than we were, say, a year ago, where we didn't have a clue as to how to deal with these, and we were just trying different things and experimenting. Now we know exactly if somebody's there, and we can treat them, we can save them. Our real risk to a patient's outcome is actually how much the system in general feels overwhelmed. Right now, our healthcare system in BC is feeling extremely overwhelmed. Hence, we've had to cancel 1,750 surgeries in the next 2 weeks. in order to make sure that enough ventilators are available, enough nursing and doctor staff, they're all available to support our patients through this. That seems to be the bigger risk, is not having enough people to provide the care, not enough resources. We do have medications.
So actually, I think you kind of answered this one, but it's around a specific. There's a question around: is it normal to have a headache for 24 hours after the first Moderna vaccine? For me, I had the AstraZeneca, and I had that kind of headache response, so I know it was normal for me. But
yeah.
This is obviously somebody who might be going through this right now.
Yeah, it's actually quite common with all 3 vaccines that we've been using right now. So Pfizer did that for myself. This person's also reporting the Moderna, and you've reported the AstraZeneca, and I've heard it from multiple other patients. But easy thing, take a Tylenol. If it goes away, that it's a side effect. Now, if the Tylenol doesn't work and your headache is still there, then you should call your doctor and say, hey, I received the vaccine. I started to get a headache the day after the vaccination. And I tried a Tylenol, as Dr. Sangara had mentioned, and it didn't do anything. What do I do now? And then let your physician take over and guide you with whatever else we need to do.
Great. There's just one last question. It's a good one, I think, to end on. The question is actually, can people, and we hear it a lot, can people choose their vaccine? And my question is, should people, or why should people choose their vaccine?
So, simple answer is, can people choose their vaccine currently in our system the way we have it set up? The answer is no. And it's not that we're trying to bully you into anything or do anything bad and nefarious to you. It's just that each day that we wait to get vaccinated, your risk of infection, as I mentioned earlier, is 1 in, what was the number? 1 in 4,700. A chance of getting COVID, and COVID is actually quite nasty. So the longer that you wait, it's almost like you're floating down a river and you're heading towards a waterfall. And as just before you reach that waterfall, somebody throws out a lifeline to you, and it just happens to be a particular lifeline that you don't want, and you say, no, I'll wait for the next one, throw me another one. And before you get to that lifeline, the one that you choose, you might just go over that waterfall. So that's the analogy I want you to think about. And we've said this many, many times. The best vaccine is the first one that's offered to you. Health Canada and NACI have not approved any bad vaccines. We've got the 3 best there are. And I'd be happy, if I were a patient, I would be happy receiving any one of the 3. And my wife is going to be receiving the AstraZeneca vaccine on the weekend. I have encouraged her to do so. I would encourage anybody that's listening to me to do the same thing. You will be completely fine. Make sure that you take a Tylenol before you go for your vaccine. Get your shot. Make sure that you hydrate properly afterwards. And get some rest. Don't make it the weekend where you're going to be doing a whole ton of yard work, etc., etc. Make sure the rest of the family pampers you.
That's great. Well, I think that's a great note to end on. Thank you, Dr. Sangara. As always, it's just been tremendous. It's really valuable, I know, for me, and I'm sure for people who are on the webinar. I do want to remind people that this is available on the BurnabyCoronavirus.com site, so you're welcome to view it again and share it with your friends. I also wanted to mention that on that same site, in the next, very soon, hopefully early next week, will be, as Dr. Sangara mentioned, the information that we get is consistent, it is constantly changing and being updated, we're so fortunate in Burnaby. We have Dr. Sangara and also Dr. Narang, who spend a tremendous amount of time looking at this information and determining what is the valuable information and what's the valid information. So we're going to start putting a daily post up, which will be be a COVID update, and it will be around vaccines and variants and all of the pieces. And it will include vetted information that you can look at. So you're welcome to go to the site. I think you'll be able to subscribe to a mail out on that as well. And look forward to more Doc Talks in the future as the landscape continues to shift. So thanks to everybody. Enjoy your Friday afternoon. Again, thanks to Dr. Sangera. So much appreciated.